Welcome, and thank you for tuning in to On the Go with CAO, a podcast by the Centers for Advanced Orthopaedics. Join us as our orthopedic specialists share their tips and advice for keeping you on the go and in the know, including the latest on how we're treating and caring for injuries and diseases of the body's bones, muscles, joints, ligaments, and tendons. We're here with over 60 offices in Virginia, Maryland, and DC to keep you active and on the go.
Welcome to On the Go with CAO. We're here with a physical therapy panel discussion, and today we're going to talk about physical therapy implications for rehabilitating athletes. Why don't we start off with just a general discussion of the athletes that we all see most often, the adult population, your classic weekend warriors and recreational athletes. What are some common injury patterns that we see, sports that are most common for injuries? Who wants to start us off?
Well, we see a lot of the weekend warriors. Golf injuries are pretty common. The softball league, the after work athlete. I would say that poor training and poor lead up prior to their sport is probably one of the biggest reasons that I see injuries. I don't know about you guys, but somebody who didn't take the time to warm up and stretch and prepare themselves is probably one of the biggest reasons that I see people getting hurt.
There's definitely a focus on different types of athletes as adults as well. I see fewer field athletes, fewer contact athletes, many more overuse injuries, as Katie alluded to, and some of that may just be the pattern of training that people go through. If you don't have a coach pushing you, if you don't have someone overseeing you from a training perspective, making sure that you're field ready, you're more prone to have those types of injuries as well.
Yeah, I think another good thing that we see a lot of is that there's this new onset of these races that are just different, these mixed combined races, right? So think of the mud runs, I can't think of another one, but the Spartan challenges or Spartan races, right? And
the
so
death race.
Right, and so that's exactly what it is. What we find a lot of athletes doing now is you have these individuals, males, females, who are collegiate athletes, high school athletes. They know what their body could do, and they forget that when they were in high school, when they were in college, when they were first starting their career off, they were actually exercising or doing those warm-up activities multiple times a day. And now we're on the other side of it where, maybe you have a family, right? Maybe you have life events that hold you back from training as much as you used to. And that kind of leads to this, well, I can still do those races. I can get out there and compete with some of these other people. And then you get those injuries that happen to it. And luckily enough, you got us, people like us, who can come together and figure out exactly what those, missing parts are to kind of fix them and put them back together.
Yeah, Sami, you bring up a good point. The line between what we would call a weekend warrior athlete and a competitive athlete has been really blurred lately with the onset of things like the mud run and the Spartan race, and also things
CrossFit training.
CrossFit, designed initially for industrial athletes and now very widespread for fitness. You get people competing into their 30s, 40s, and 50s and really training at the level that some of these younger athletes may have been. And so there used to be this line where you finished high school for most of us, or maybe college if you were lucky, and now you transition to things like golf and 5Ks. And now you have people, doing powerlift compound movements with resistance well into later adulthood. And I think it's really changed the injury paradigm as well as the rehab considerations for it. It's a great point.
Well, I think the trick about it too is that, I have seen some of these CrossFitters and, some of these elite athletes who are in their 50s and 60s, and they're training the same way you would get a 21-year-old collegiate, D1 athlete, and they're fine. It's the people in between. I know right now, no matter how much exercise I try to admit that I do or guess that I do, that if I were to jump out there and try to compete with these guys, I would be showing up in your clinic with my back all hurt and asking you to work on me.
And we'll take good care of these things.
I appreciate that.
Plus, our day-to-day life is different now. We sit a lot more during the day. We're working, as opposed to when we were younger and we weren't sitting, 80% of our day. Our posture and our body mechanics and just the things that we do are different than we did 10 years ago or 20 years ago. So it's easy to think that you're still in your same shape, but really most of your day-to-day activities do not prepare you to go out and run a race or do a power lift or a CrossFit Games.
I'm sure some of our listeners are curious what we recommend as the rehab professionals. Is it wise for people, maybe if they haven't been competing at a higher level or even active at all, to get into things like a mud run? Is that something they should consider? Or should they consider a CrossFit type gym if they are, let's say, 35 to 40 and haven't been active for a period? Is that in their interest, or do they run a risk of being injured?
I would never recommend not to do it. I would just recommend to train appropriately and gradually increase your way in so that you're prepared when you do get time for game day or race day or whatever it is.
I see a lot of people that are doing very sport specific. So it's almost the opposite of what you're saying. So we find that our runners are running and that's what they do. Our golfers are doing golf and that's what they do. And they're not getting like the components of the sport broken down. So they're not as prepared at that level. So they're running from their cup of coffee in the morning to the first tee. And so they're not necessarily preparing that way. So there's got to be a happy combination to be able to incorporate the different components of the sport or to do some different sports and complement each other.
Absolutely.
Yeah.
Well, I think you guys both tapped onto it, right? It's about, if you're going to be an athlete, let's be an athlete, right? I think we all love it when we get people who are going to move. We all love working with those people and promoting that activity. We all know that functional fitness, right, will lead to longevity in life. But what we find is that, an athlete, if they're going to go do a mud run or a Spartan race, right, they've got a 10-week program. Like, they've got time to build the mobility and the strength and to break down those exercises and the different components. And most of the guys that we have or girls coming in, the thing is that they're not doing that, right? They're just going and doing the race, and then, I gladly will stand at the end of the race and just pass out my cards and hope that I will get some of them to come see me so we can fix them to get them ready for the next race.
And the thing is, there are so many programs now to help you get to that point. There's so many couch to 5K training programs or marathon training programs, or CrossFit has tons of levels and progressions to go through. So I'm not exactly sure why people aren't going through those progressions all the time, but there's plenty of resources to do it.
It brings up a great point. When is physical therapy appropriate for an injured athlete? And really, what defines an injury? Do you have to wait until you have a fracture or a terrible sprain? Or is it a nagging pain? Or is it just that you feel like you're not moving the way that you want to? When is physical therapy an appropriate timed intervention?
I think that's a tough question. I have a couple of really good friends of mine who kind of work with us and we kind of collaborate with, and our athletic trainers. And one of the big conversations I have with them is, where is the line where it blurs, right, between physical therapy and athletic training and kind of where we go. And I believe it is the FMS system, right? They have the way they break their stuff down is really, the SFMA, the selective functional movement assessment, is the line of pain. If pain is involved, if there's a reason that you can't move the way you want to and you're limited by that, then you're in my domain or in our domain, and we're really trying to get you back to that level and get you safe so that way you can get to training components, right? I mean, I say it every day, the best therapists are never going to out-train the best trainers because the best trainers train every day. But in our world, in our field, is that if you've got someone that's not moving the right way and they're in pain or pain is somehow associated with that, I feel like that's our first job, is to get to that pain, to figure out what the mechanics are, right, fix it, teach them so that way they can move better and get them back into that field. And then there's a little bit of work that goes with that.
That's a good point. The difference between the fitness realm and the rehabilitation realm, that medical diagnosis background of why are you hurting? There's blurriness now in personal training. There's corrective exercise specialties, rehabilitative exercise specialists, and that can cause some confusion for the consumer. When do I see a personal trainer who's a corrective exercise specialist, and when I see somebody with a doctorate in physical therapy? And I think your pain point, your dysfunction point is well taken.
It doesn't always have to be one or the other. I feel like if we could blend it more, I think the physical therapist is the best at diagnosing a movement dysfunction. A personal trainer is a lot of times, not all the time, but a lot of times better at loading patients and getting them really to their return to sport or return to their prior level, sometimes better than the physical therapist does. Sometimes the combination of the two is helpful.
I find the combination can be really helpful, especially if you're talking about athletes that are on a more elite level or very competitive. If you're working with a lot of golfers go ahead and they work with golf pros. And if the golf pro is trying to get a swing just right, but the patient doesn't have the trunk rotation to get it or the hip mobility, then it's a really nice adjunct to work together and get the pro and the therapist working as a group. And so we do that a lot with personal trainers as well. We have a lot of, we've had a number of co-treats where we work with them, we work with the patient. The therapist can identify vulnerabilities and weaknesses or restrictions, and then the trainer can help carry it out and work with them on a daily basis.
I'd like to shift gears for a second. We get a lot of questions as rehab professionals from coaches, parents, concerned aunts, right, about when should kids start getting into competitive sports? How much is too much? When should we pull them back? Should they rest, not rest? Should they play more than one sport? there's a lot of questions and frankly a lot of myths surrounding youth sports, especially in today's culture, where there's more and more pressure from a young age to perform at a very, very high level. Katie, if you don't mind, I'm going to pivot to you first. I know you have an athletic training background and you have a background in pediatrics. Give us your take on youth sports injuries and the rehab process.
It's really tricky now because there is a lot of misinformation. You know, back in the day when I was a gymnast, you dedicated all of your time to that, and now they really encourage you not to do that. Most of the research shows that you should be doing multiple sports, having an on-season and an off-season, or at least a preseason and a postseason so you get some rest time. But it's really hard because if you really want to be an elite athlete, most coaches in most sports, you know, try to encourage you to stay in one realm. But in general, I think the best thing to do is to be cross-training. You know, give yourself some time to, you know, weightlift, run, no matter the sport. You know, whether you're a gymnast or a runner or a, you know, figure skater, whatever it may be, training in multiple realms will keep your body strong and mobile and balanced, and it'll allow for less injuries over time. But you know, youth athletes are not just small-sized adults. They are growing. They are going through changes. Their body awareness and their connection from brain to body is not the same as an adult. So you can't just train like an adult and think that they'll be injury-free. On the flip side of that, I think a lot of people don't push youth athletes enough. They would say, you know, don't lift weights because they're still growing, or, you know, don't train 3 and 4 days a week. You can, you just have to be careful about the way that you're doing it. You have to have load restrictions. That's why there's, you know, pitch counts for young pitchers, and that's why there's extension limitations for young gymnasts. And you don't want to overtrain and you don't want to overload the body, but you can load it some in a safe way without causing injury.
I think one of the challenges is the pressure that coaches and parents put on young athletes, because if you're 9 years old, you're not going to advocate for yourself, right? And a lot of times as rehab professionals, that becomes our job, within reason. And certainly we want athletes to succeed. We want athletes to get back to competition as quickly as is safe. But we also, Katie, you made a great point that young athletes are still developing. And so in contrast to adults, there's some body systems and some structural considerations that we have to keep in mind, because we could end up doing some permanent harm if we push them too quickly, or we fail to account for those considerations when we design their rehab programs. So kids have a bright future ahead of them, and at some point sports does have an expiration date. And we need to consider that we live in the same body for the rest of our lives. And it's our job to make sure that we preserve that function well past soccer, football, etc.
A lot of kids just don't listen to their bodies. You know, if you, like concussion is a great example, or, you know, even other things. A kid just wants to play, or a kid just wants to get back out there. So it's not that they're trying to ignore what they're feeling. They don't notice it. They say, well, I'll just hang this other way, or I'll just run a different way. And that's when you start getting compensations or, you know, other issues, you know, down the road, because they just wanted to get back out there any way they could, and they end up hurting something else or causing these long-term overuse injuries.
This has been a great discussion. Let's go down the panel one at a time. Closing statements, parting wisdom. Any last parting shots for our viewers? Sami.
I guess I would say that, you know, move well and move often. I think that's the biggest thing that we could take away, no matter what age you're dealing with. I think that we all can take time to, you know, whether it's meet with a trainer or a physical therapist, to learn how to move better, to allow us to move longer. And that's it. It's a continuum, right? That's the hardest thing about this. And when it comes down to whether it's an injured or non-injured or soon to be injured athlete, it's understanding you only get one body. So optimizing performance is the only thing that you can do.
I like that. I'll say one thing that doesn't get enough attention across the board, having children myself in sports, all the way up to our octogenarians that we see, is I think you really need to take some time and stretch and make sure that you have the components available to you to do the sport that you're looking to do. That if you want to be a tennis player or a golfer, you need to make sure you've got the rotation, the motions that you need to have. And so think about what you're doing, listen to your body, stretch, try to get the best mechanics you can. I always say there's a difference between being in the training room and being on the field. When you're on the field, you do what you need to do the sport. When you're in the training room, isolate what you're doing, make sure you're aware of the specific things that you're trying to accomplish that day, And if things aren't going right, then seek help and find somebody that can help you identify where you need to work.
Wonderful. Katie.
You guys said it so beautifully. There's not much more to say. I mean, I totally agree. If you're gonna have a goal of running a 5K or competing in a CrossFit Games, just make sure that you train appropriately and progress yourself, so that you're prepared for it. If you're gonna sit a lot, stand some throughout the day. If you're gonna do a lot of pushing, also balance it with a lot of pulling. Try to be, like Elissa said, as best as you can in terms of mechanics, so that you don't have as much breakdown and injury.
And certainly to echo all those sentiments, I think I speak for all of us and frankly our profession. When we ask the listeners and viewers, if your body hurts, seek help, advocate for yourself. It's better to get intervention earlier than later. Your recovery is usually faster, it's usually more complete. We can get you back to the things you're missing a whole lot faster and a whole lot more safely. Thank you all for joining us. This has been a really fun time. I know I speak for all of my panel partners when I say we enjoy physical therapy. We enjoy talking about what we're passionate about. And we thank you, the listeners and the viewers, for tuning in for On the Go with CAO. Until next time, be safe, be well, and we'll talk to you soon.
We hope you enjoyed this episode of On the Go with CAO and invite you to tune in next time. To learn more about our upcoming episodes or to check out our online library of previously broadcast episodes, please visit cfaortho.com/hub. That's /HUB. Or search for On the Go with CAO on your favorite podcast app. Want to help keep others healthy and on the go? Then please share this episode. At CAO, you'll find over 160 orthopedic specialists committed to providing patients with an exceptional standard of care. The information contained in the On the Go with CAO podcast is for informational purposes only. It is neither intended as rendering medical advice nor as a substitute for seeking professional medical assistance. No relationship between the Centers for Advanced Orthopaedics and its practitioners may be created through On the Go with CAO. Any individual with specific questions regarding his or her individual health or treatment options should contact the Centers for Advanced Orthopaedics and schedule an appointment with one of its practitioners.